Thank you, Danielle. Let's go. This is Laura Mary reporting on the fourth concerning question. Are the sterilizers in the clinic working properly based on the BC standards? There are 4 concerns. Number 1, fluctuating temperature. Number 2, improper temperature to kill organisms. Number 3, sterilization tape or strips do not indicate that instruments are completely sterile. Number 4, improper temperature could be linked to cross-contamination. Recently, we had a conversation with Dr. Wilson and asked him some questions about these concerns, but he responded that he was not sure about when the sterilizer was last tested, but he thinks that they follow the protocols and the equipment is checked on a regular basis. He also mentioned that he was not aware of the temperature changes of the sterilizer. On a document that we obtained from this office about the biological tests that are performed once a week, it was possible to see that the sterilizer number 1 showed some growth, but the same test was repeated on the same date and it came out negative. What are the learning issues about the sterilizer? The main problem about the sterilizer is that the temperature changes, and this is a concern to us as there has been a client complaining about an eye infection and oral lesions resulting from the dental hygienist treatment that was provided in this office. We did our research and found that based on the Centers for Disease Control and Prevention, CDC, sterilization procedures should be monitored using biological, mechanical, and chemical indicators. Biological indicators, also known as pore tests, are the most accepted means of monitoring sterilization because they assess the sterilization process by directly killing known highly resistant microorganisms. Mechanical and chemical tests should be done for each cycle, but they do not indicate that instruments are completely sterile. Based on the CDHBC infection control guidelines, we found that the daily operation of every sterilizer must be reviewed and documented. A record must be kept indicating that the sterilizer has been operating as required or noting any malfunctions or actions that were taken. We also found that disinfection and sterilization are essential for ensuring that medical and surgical instruments do not transmit infection pathogens to patients. On the other hand, based on our research and investigations, we found about this bacteria known as Pseudomonas aeruginosa. This is a gram-negative bacteria that is found primarily in water and medical equipment that has not been properly cleaned. It is the most common causal factor of infections, and it causes blood and lung infections. It is spread to people in healthcare settings that are exposed to water or soil, contaminated hands, equipment, or surfaces that have failed proper sterilization or disinfection. The symptoms related to this bacteria are in the eyes, pain, redness, and swelling; in the lungs, pneumonia, severe coughing and congestion; and in the wounds, green or pus discharge. Who is at risk? Immunocompromised clients with HIV or diabetes type 2. Healthcare providers should pay careful attention to recommended infection control practices, including hand hygiene and environmental cleaning, to reduce the risk of spreading these germs to patients. Thank you so much for listening. For now, I'm going to pass it on to my colleague, Bonnie Chan, and she's going to continue with the investigations.
Thank you, Laura. This is Bonnie Chan recording on the 5th concern in question, warm water line units. In the PBL scenario, the hygienist even stated, your operatory even has a water warming unit that is well received by your clients. So, what is dental water line units? The water line of a dental unit typically construct from a polymer or silicone rubber tubing which provides water from its source for irrigation, cooling, and flushing of the client's oral cavity during dental procedures. And what are the concerns? So according to the CDHBC, the office using communal water supplies, water line heaters should not be used, has the heat encourage the growth of microorganisms. And dental unit water lines are known to harbor many bacteria, such as Pseudomonas aeruginosa and Legionella pneumophila. Most microorganisms detected in dental unit water lines come from public water supplies and do not pose a threat for healthy clients. However, bacterially infected water can cause serious infections, especially in the elderly and in immunocompromised clients. and can lead to conjunctivitis as well as to respiratory-related disease and bowel disorders. The conversations we have with Dr. Wilson. First question is, why are they using warm water for the waterline unit? There is an infection control guideline that they shouldn't use warm water for waterline unit. Are you aware of that? What is the temperature of the water? Do they use any solution to clean the waterline unit? And what are the procedure in cleaning waterline unit in between clients? And the last question is, do they test the waterline units? The picture was given to us by Dr. Wilson, saying that this is the result of a test that they did on the dental unit waterlines, which is compared prior to purging and after 3 minutes of purging. So the findings that we have are Dr. Wilson is not aware that the waterline heater should not be used, as the heat encourages the growth of microorganisms. They use warm water because clients really like it. They use a water bottle system, push the water for 30 seconds in between clients, and shock the line at least once a week. They use shocking solution but doesn't know the actual solution and needs to ask the staff. The temperature of the water is 22 Celsius degrees, and according to the test provided by Dr. Wilson, shows that after purging for 3 minutes, the CFUs are within normal limits. Now, let's pass on to the reporter, Kieran Carr, to give us the conclusion.
Thank you so much, Bonnie. So after looking at all the research and all the information given from Dr. Wilson, we have come to a conclusion that a water warming unit installed in the dental hygiene room has the tendency of harboring various types of pathogenic bacteria. Naming few of them, Pseudomonas aeruginosa, Legionella pneumophila, non-tuberculosis mycobacteria, acanthamoeba. Research have supported the presence of these microorganisms in the regular dental water lines. So to conclude our report regarding the symptoms showed by the clients, we are linking them to the dental unit in the hygiene room. Because it is equipped with a water warming unit that keeps the water temperature at 22 degrees Celsius. Although we know that the patients prefer warmer water, the warming unit attached to the dental unit harbors all the above mentioned pathogenic microbes. According to our research, these microbes are responsible for causing the eye and the respiratory infections in the immunocompromised clients. HIV positive and complaints about the oral lesion could have been cross-infected due to the lack of proper sterilization. Even though the biological indication tests have shown only one positive test, the retest showed no growth. The assistant did report the faulty function of the sterilizer to achieve the right temperature. According to our research, there is minimal to no chance of acquiring HIV in the dental office. Various other viruses and bacteria, such as Pseudomonas aeruginosa, cause oral lesion in an immunocompromised patient. Another important link between the dental unit water lines and ocular infection was brought into light when the patient filed this lawsuit against the dentist after acquiring a serious eye infection. The case reported that the infection was caused by a protozoa named acanthamoeba that inhabits the tubes of dental units. It is very interesting that we found that the bacteria Legionella tends to actually live inside acanthamoeba. In a parametric analysis conducted in Quebec, the results showed that the maximum number of bacteria were found to grow at a temperature of 22 degrees and 25 degrees Celsius. This analysis stated that the dental unit water lines act as an ecosystem for the opportunistic bacteria and pathogens that can reach dangerous high numbers in these water lines. Further, we're going to talk about a few of these pathogenic bacteria. The first one's going to be Pseudomonas aeruginosa. It has been reported that this bacteria has the potential to cause infections in immunocompromised patients. In Canada specifically, this bacteria was found in about 25% of the dental unit water lines. It can also cause oral infection in the clients. The client who reported HIV positive in Dr. Wilson's office is more prone to cross-infection from the bacteria. Thus, the client has a potential to develop various types of oral lesions. Another reviewed article links Pseudomonas with skin infections, UTI, burns, eye infections, and various bloodstream infections. Next, we're going to talk about Legionella. This bacteria has the potential of causing severe lung diseases. The early symptoms could be fever, chills, cough. In a review article, it was stated that this bacteria can cause fatal respiratory infections and is also linked to ocular infections. This bacteria is found in warmer water. The average temperature where it flourished the most is 23 degrees.
Thank you for our in-field reporters, Natalie, Danielle, Laura, and Bonnie. Now we all know what have caused the underlying infections from the complaining clients. Next headline this morning, Team A's learning outcomes about the problem-based learning project.
Our group came together to reflect about the ways problem-based learning promotes critical thinking, and we came up with that it causes you to look at multiple sides to the problem. All assumptions have to be backed up with evidence. Causes you to find greater understanding for concepts in detail. You have to do your research for background knowledge about what's right and what's wrong. Makes you learn about clinical environments, protocols, and guidelines. Causes you to be open-minded to solve problems and to make decisions together as a team.
What elements of the PBL process prepare students for real practice? First, it gives a glimpse of what the students should expect in practice. It helped develop professional conversation skills by preparing students to talk to dentists or owners about concerns in the workplace. It facilitates collaboration as students learn to work with the staff, or in our case, the team members, in the dental setting. It taught us to be mindful and aware of the guidelines and protocols of practice, and to be able to identify what is considered a violation by reviewing CDHBC practice standards and doing research. As a dental hygienist, it is important to be able to speak our minds about any concerns we have about criteria that are unmet in practice and in regards to client care. One of the ways working as a team supported our learning as a group was the ability for us to share each other's knowledge on certain topics. For example, Kieran and Bonnie have real-life practice experience, and Erica experienced PBL before. Each of us came up with questions for Dr. Wilson and talked about the results for the learning issues. Another way is that each team member has different perspectives to contribute. We each researched the 5 suggestions for Dr. Wilson and were able to collaborate to find the culprit. There was also the proper distribution of workload. Working together, we were able to stay organized and everyone was responsible for their own topic. We listed down all the learning issues on the PBL one, then assigned the issues alphabetically so that the topics were randomized. We also made and met deadlines for all the required research and set goals together.